All right, let's talk about something that so many of us have dealt with, that nagging tendon pain. You know what I'm talking about. The tennis elbow, the jumper's knee, that Achilles ache that just will not go away. It's beyond frustrating. Well, today we're going to pull back the curtain and find out the real reason it won't heal, and more importantly, what we can actually do about it.
So this is the big question, right? You've got what everyone, maybe even your doctor, calls tendonitis. But it just lingers and lingers. It feels like you're stuck in this endless loop of pain, rest, and then more pain. So why? What is going on here? You've probably done all the standard stuff. You took time off, you've been popping ibuprofen like it's candy, but the second you get back to your activity, boom, the pain is right back where it started. And that's because, it turns out, we might be fighting the wrong enemy altogether.
Okay, so here it is, the big reveal. The reason those treatments don't work for chronic pain is that we've been using the wrong word. The problem isn't inflammation. The real problem is degeneration. And that one little word changes everything.
This slide really breaks it all down. Over on the left, we've got tendonitis. Now that's a real thing. It's acute inflammation, maybe from one specific event. And for that, rest, ice, and anti-inflammatories, perfect. But that nagging, long-term pain, that's what you see on the right, tendinosis. This is a whole different beast. It's chronic degeneration, a breakdown of the tendon, from tiny bits of damage over and over again. And the treatment isn't to calm it down, it's to rebuild it.
And look, the science really backs this up. When researchers look at the tissue from these chronic injuries, they don't see inflammatory cells. They see disorganized, weak tissue. This is the smoking gun. It's exactly why those anti-inflammatory pills just don't solve the underlying issue.
So let's get this straight, because it's the most important takeaway. Your problem probably isn't swelling. Think of it more like a frayed rope. The fibers are weak, they're jumbled up, and the whole structure is just worn out. And you don't fix a frayed rope by just looking at it. You have to reweave it and make it strong again.
So you might be wondering, okay, why are my tendons so prone to this? Well, it kind of comes down to a fundamental flaw in their design. A trade-off, really.
Now, don't get me wrong, tendons are incredible. They're like these super strong biological cables that let your muscles move your bones. Just unbelievably tough. But here's the catch. They have a terrible blood supply. And if you know anything about healing, you know blood flow is everything. It brings in the nutrients, the oxygen, all the good stuff needed for repair. Less blood flow means healing happens at a snail's pace.
So what are we aiming for? What does a healthy tendon even look like? Well, it's about 80% type 1 collagen. And you can just think of that as the good stuff. The thick, strong, neatly aligned fibers that can handle incredible forces. This is the gold standard.
Now look at this timeline. This really puts things into perspective. After an injury, sure, there's a quick inflammatory phase, but then the body just lays down this shoddy, weak patch material. That's type 3 collagen. And the process of turning that weak patch back into the strong, organized stuff, that can take from 6 weeks to, well, over a year, a whole year. And here's a tough pill to swallow, but it's crucial to understand. Because that healing process is so slow and imperfect, a badly injured tendon might never be exactly the same again. It might not get back to 100%. And that's precisely why a wait-and-see approach is so risky. We need to be proactive to get it as strong as possible.
All right, enough of the bad news. If rest is the wrong move, what's the right one? Let's get into the good stuff, the actual, proven solution. It's time to rebuild, not just rest.
This chart says it all. In the effective column, you have these active strategies, things like eccentric loading and heavy, slow resistance training. And on the other side, the stuff that doesn't work or is even risky. Complete rest just makes the tendon weaker. And those corticosteroid shots? Yeah, they might kill the pain for a bit, but they can actually increase the risk of the tendon tearing later on. Yikes.
So here's the big mindset shift. We need to stop trying to baby the tendon. The goal is to apply the right kind of stress. We need to strategically load it to send a signal to the cells inside, basically telling them, hey, wake up. We need to build some new, strong tissue here. You literally have to load it to heal it.
So what is this magic eccentric loading? It sounds complicated, but it's super simple. It's just the breaking part of any movement. Think about doing a bicep curl. It's not lifting the weight up, it's the act of slowly lowering it back down. That controlled lengthening under load is like a powerful medicine for your tendons. So, what's happening on the inside?
Well, that controlled load acts like a signal that wakes up those sleepy tendon cells. They start churning out new, healthy collagen. And this is the really cool part, the load actually helps guide those new fibers to line up properly, making that frayed rope strong and organized again.
So now that we get the problem and the fix, how do we put this all together? Let's talk about a game plan for the long haul so you can build tendons that are resilient and strong.
Honestly, this is your blueprint for healthy tendons. And no surprises here, right? It's the fundamentals. Always warm up, manage your training load carefully, get enough rest. But notice that strengthening the eccentric phase is on this list. It's not just for rehab, it's a key part of prevention too. If you take away just one practical tip today, please let it be this one, the 10% rule. It's so simple. Don't increase how much you're doing or how hard you're doing it by more than 10% per week. Tendons adapt very slowly. Big jumps in training are just asking for trouble. Slow and steady really does win the race.
So let's leave it with this thought. Knowing that the real enemy is a weak, worn-out tissue, not a fiery, inflamed one, is a total game changer. It should change how you think about your pain, how you rehab, and how you train from now on. The power to fix this isn't in a pill bottle, it's in rebuilding. So what are you going to do differently?